It was embarrassing taking the patient off the table, and I felt that I was not able to provide the care and the need the person needed because I had to take the patient off the table. I had a patient who had serious heart problems, and they came to get a procedure done at our hospital. The doctor wanted a less invasive procedure to evaluate the patient, so we decided to go for a CT scan. In the middle of our CT scan, we got a call stating that there was no pre-authorization for this procedure and we had to stop. And we had to take the patient off the table and take her back to the cath lab. But it was heartbreaking having to take your patient off the table for a procedure that should have been simply done because it was warranted.
We agree with Senator Sanders. Healthcare is a human right.
We're not being wise in our choices as we exclude people and don't include them and don't help them get the care they need when they need to get it. It's much more efficient and much better for all of us.
Many times I've had patients that have had to say they can't do their colonoscopy this year because they can't afford the new $8,000 deductible.
Why aren't you coming to your doctor visit? Why aren't you doing what you're supposed to do to take care of your health? Well, most of them can't afford it or do not have access or a way of paying for what they need. It's the fault in the system that allows profiteering, where pharmaceuticals can make a lot of money on medications that even if the patients did get the treatment they need, they cannot afford to keep up the care.
Nurses from all over the country are here today to highlight the fact that it's about time we have Medicare for All. It's long overdue.
Medicare for All would put the power back into the healthcare professional hands, not only the doctors but the nurses. They work together side by side. Your recommendation and your clinical judgment and your experience and your years of knowledge will come to benefit the patient and not worrying about whether what we plan could be afforded or not. Medicare for All will cover that and will ensure that the patient has proper health care needed for survival and in order to maintain any treatment that is given.
Together from coast to coast, we're going to roll up our sleeves. We're going to take on the insurance companies, take on the drug companies, and we are going to build the American dream.